Hello, my name is Bella Harrison, and today I will be presenting on a woman with a mental health disorder in the perinatal period. This resource is designed for midwives and healthcare professionals with the aim of raising awareness, enhancing knowledge, and improving the quality of care for this vulnerable population. Today I will discuss the influence of past medical history and social determinants of health, the impact on pregnancy and childbirth, barriers to accessing care, current services available, and implications for midwifery practice. Women experiencing mental health disorders during pregnancy and the postnatal period are considered a vulnerable group of women. Vulnerability arises when a personal, social, and systemic factor overlaps to increase health difficulties. Perinatal mental health disorders are common, affecting up to 1 in 5 women, yet they are frequently under-recognised and undertreated. Midwives are in a unique position to identify, support, and advocate for women in this group, making awareness and responsive practice essential. The risk of perinatal mental health disorders is influenced by both past medical history and social determinants. A history of psychotic illness, exposure to trauma or domestic violence, and substance use are well-established risk factors that increase the risk of vulnerability. Equally important are social determinants of health, including poverty, insecure housing, unemployment, limited education opportunities, and inadequate social support. Stigma surrounding mental health combined with cultural expectations of motherhood may further exacerbate psychological distress and act as barriers to help seek. Common conditions include perinatal depression, anxiety disorders, post-traumatic stress disorders, which are often related to previous birth traumas, and less common we have bipolar disorders or psychosis. Each disorder carries unique challenges. For example, perinatal depression can impair maternal-infant bonding, whilst bipolar disorders may require complex medication management and sometimes becoming an inpatient. Recognizing the diversity of conditions is vital for tailoring midwifery care and making timely referrals. Maternal mental health disorders can significantly affect pregnancy and birth outcomes. They are associated with an increased risk of preterm birth, low birth weight, and obstetric complications. Women may experience difficulties engaging with antenatal care, leading to missed opportunities for intervention, if needed. Postnatally, untreated mental health illnesses can impair maternal responsiveness, disturb infant attachment, and negatively influence the child's emotional and cognitive development. Long-term consequences include chronic depression and a heightened risk of suicide, which remains the leading cause of maternal death in high-income areas. Despite the risks, women face considerable barriers accessing maternity and mental health care. Stigma and fear of judgment can prevent disclosure of symptoms. Fragmentation between maternity and mental health services often result in women falling through the gaps. Cultural and linguistic barriers may reduce accessibility for migrants and refugee women, whilst Aboriginal and Torres Strait Island women may feel as though they experience systemic racism and mistrust of the service. Additionally, service availability is often limited in rural and remote areas. Collectively, these barriers perpetuate inadequacies for women and worsen the outcomes for mental health. Current responses to perinatal mental health vulnerabilities involves both maternity-led care and broader primary health strategies. Universal screening tools such as the Edinburgh Postnatal Depression Scale are widely used to identify women at risk, though follow-up care can be inconsistent at times. Specialist perinatal mental health teams, where available, provide multidisciplinary support, whilst community-based programs offer group education and peer connection. Importantly, midwives play a central role by fostering continuity of care, listening with empathy, and advocating for women, as well as ensuring that timely referrals are made to appropriate services. Evidence shows that these supportive relationships improve engagement and health outcomes, although challenges remained in scaling them to rural and underserved communities. The care of a woman with a mental health disorder is guided by both national and international frameworks. In Australia, the National Perinatal Mental Health Guideline emphasises routine screening, culturally appropriate support, and integrated services pathways. The Midwifery Standard for Practice highlights respectful partnership, advocacy, and collaboration between teams. Globally, the World Health Organization stresses maternal mental health as a public health priority. Research evidence demonstrates that midwifery-led continuity models and trauma-informed care are effective strategies to reduce inadequacies. These guidelines and policies provide a framework for best practice. For midwives, the implications are profound. Care must be woman-centred, trauma-informed, and culturally safe at all times. Building trusting relationship reduces stigma and encourages disclosure of mental health concerns. Midwives must be confident in screening and referrals, whilst respecting a woman's autonomy and her choices at all times. Collaborative practice with GPs, psychologists, psychiatrists, and social workers are essential to provide holistic care. Through advocacy, midwives can also influence policies and service design to better meet the needs of this population. Ultimately, midwives have a vital role in reducing inadequacies and promoting maternal and infant well-being. To support practice, several professional resources are available to guide care. PANDA offers a national helpline and professional development modules tailored to perinatal mental health. Then we have Beyond Blue, which provides educational materials and fact sheets for both clinicians and families. The Centre of Perinatal Excellence, or commonly known as COPE, has developed evidence-based guidelines and training programs that help clinicians implement best practice for women. Internationally, the World Health Organization offers toolkits and training resources that emphasizes maternal and mental health as a global priority. Directing midwives and healthcare professionals to these resources ensure that practice remains current, evidence-based, and responsive to the diverse needs of these women. In conclusion, women experiencing mental health disorders in the perinatal period represent a vulnerable population due to the complex past medical history, social determinants, and systemic barriers. These conditions profoundly affect pregnancy, childbirth, and long-term outcomes for both mothers and children. Midwives, through evidence-based, respectful, and collaborative practice, are uniquely placed to reduce inadequacies and improve outcomes. By increasing awareness and embracing trauma-informed approaches and signposting to resources, midwives can ensure that women with mental health disorders receive the safest, highest of quality care that they deserve. Thank you very much for listening.